Welcome to Coping with COVID-19. I'm Dr. Allie Sharma. This is an interview series and safe space to collectively cope and share our stories through the COVID-19 pandemic. Quick disclaimer, please note that this interview series is for informational purposes only, and it's not considered medical advice. Please consult your own provider for any issues you may be facing, and if you are in crisis, please call 911 or call your local emergency services. Today I am joined by Dr. Van Yu. Dr. Yu is Chief Medical Officer of Janian Medical Care and its parent agency, CUCS, or the Center for Urban Community Services. Dr. Yu earned his medical degree from the State University of New York at Stony Brook in 1995 and completed a residency in psychiatry in 1999, including serving as chief resident at NYU Medical Center. After completing residency, Dr. Yu was an attending psychiatrist at Bellevue in the CPEP, which is the Comprehensive Psychiatric Emergency Program, for 2 years before becoming assistant director from April 2001 to March 2003. He joined the Project for Psychiatric Outreach to the Homeless, the precursor of Janian Medical Care, as a staff psychiatrist in April 2003. He also served as medical director of the Manhattan Outreach Consortium from 2007 to 2013. Dr. Yu is a clinical assistant professor at the NYU School of Medicine, where he's had a faculty appointment since 1998. I'm bringing Dr. Van Yu to join me now. All right. Hi, Dr. Yu. It's so lovely to see you, and thank you for joining me on Coping with COVID-19.
Thanks for having me.
Okay, so let's start by having you describe to our listeners a bit more about the mission at Janian and specifically the context in which you support the homeless population and your work pre-pandemic.
Sure, yes. So Janian Medical Care is an agency that's part of a bigger agency. It's the agency that employs the licensed medical staff, so the psychiatric providers, the primary care providers, and the nurses of a bigger social service agency, which is the Center for Urban Community Services, CUCS. And what both agencies do together is we provide services, including housing services and primary care and psychiatric and nursing services to homeless New Yorkers with outreach teams, shelters, safe havens, and in-housing programs.
Okay, great. So now let's go to the pandemic. So you're a leader in this organization, and as the pandemic set in, and given the structure of the way you work, right? For example, I know we spoke about sometimes there's 8 to a dorm with people sleeping in close proximity, staff around. So what are the kinds of risks and challenges that you started to anticipate both for your clients and for your workforce?
Right, so the immediate challenge that you think of with an infectious, contagious illness is you have clientele living in pretty close quarters in certain kinds of settings, right? So mostly in shelters and safe havens. So a safe haven is a place where people who are living outside can come inside if they're willing to come in while they're waiting for housing. So they're similar to shelters. Most shelters and safe havens have dorm-style sleeping arrangements, right? So like, for example, one of our shelters in the Bronx has 8-person dorms and 12-person dorms. So if you have one person who's contagious in an 8-person dorm or a 12-person dorm, depending on how contagious that illness is, you risk infecting everyone else in the dorm, not to mention everyone else in the shelter. And you have our shelters are about 100 people each, but you have 200-person shelters, 400-person shelters, things like this. So once an infectious agent gets into a shelter population, it's very difficult to contain it, right? So that was like everyone's immediate worry, at the agency and also in the city as a whole, the Department of Homeless Services. So what the Department of Homeless Services has been able to do over the last several weeks is to create these isolation facilities. Basically, they've taken over. I don't know exactly how I don't think they've bought the hotels. I think they're renting the hotels. They've taken over these hotels and turned them into these isolation facilities, which allows people it started out just people who were symptomatic with COVID symptoms, either presumed or confirmed, to be staying in a hotel room, and here's one of the keys, with their own bathroom. So they could really isolate, right? And right now, there's like 750 units of those that are available to people that are, I don't know exactly today how many are filled, right? And there's gonna be about 1,000 units in the next, in the days and weeks to come, right? In addition to that, the city has set aside 7,000 units to just de-densify the shelter. That's like a new word we're all started using, de-densifying, right? So so a couple of weeks ago, the city started moving older people and people with certain vulnerabilities out of the shelter system into these other hotel rooms, right? And they're up to 7,000 people now in these units. And so the single adult system is about 57,000. No, the single adult system is about 17,000 people. The whole system is 57,000 people.
Okay.
So a significant portion of the shelter population is now in these hotel rooms.
Okay. And what are the criteria, knowing that they have probably changed over time, for getting admitted to an isolation room or area?
Right. So the isolation facilities, it started out that you had to have certain actually right in the early days of this, right? I'm referring to like March as the early days.
Okay.
The criteria was you either had to have a confirmed positive COVID test or you were awaiting the result of the COVID test. And remember back then, you had to be pretty sick to even get tested, right?
And it was so hard to get a test.
Yes, yes. And then that's developed now so that, and that's because there were not so many units available. Now that there's 750 plus units, the criteria has relaxed a bit, right? So people with basically suspicious symptoms, so people who are presumed COVID now are eligible to be moved into these isolation.
Okay. Now I'm curious at the same time, I mean, you manage a medical staff, healthcare providers.
Yes.
Can you tell me your thoughts as a leader about your fears and anxieties, managing both your staff as well as the clients, and just how your staff have been doing, given that they are on the front lines?
Yeah, so in addition to protecting our clients, right, and I only got a chance to speak about our shelter clients, are like 1.5, concern, that was our first concern. Our 1.5 concern was like, of course, our whole staff, right?
Yeah.
So the whole agency, I'll start with the whole agency. The whole agency moved very quickly to doing as much remotely as possible, right? Which for an agency like ours was like, I mean, it's a challenge for everyone, but like I think a particular challenge for us, we're a client-facing social service agency and medical, care providing agency. So like our whole agency has been set up to get people in rooms together to like work together, right?
Right.
So in like 2 weeks, we had to like totally flip it so that we're doing as much as we can, by phone or other telehealth ways of doing things, which is something we had no infrastructure to do to begin, to start out with, because we were doing everything in person. So for example, our whole psychiatry staff went telephonic in basically a week, right? And we're reaching out to all of our patients by telephone or by devices, right? And so the psychiatric staff is really only doing in-person visits now for people who need like depot antipsychotic medication, so shots, injections of medications. Someone has to actually physically show up and give the shot. Our primary care providers, there's sort of a limit to how much primary care you can deliver telephonically and in a telehealth platform. You can do quite a bit, but not everything. So the primary care staff has really still been doing mostly what they were always doing, which is seeing people in person.
Right.
And of course, again, speaking about the early days of the pandemic, which is only March, we didn't have masks. I mean, we had masks, but we had very low supplies of masks and face shields and gowns and gloves, because normally we don't use any of that stuff. I mean, we use gloves, but we're not doing any procedures that require that level of personal protective equipment. And then what ended up happening is that, unfortunately, a few of our providers got COVID, right? So it was 3 primary care providers and 4 psychiatrists. Thankfully, I'm knocking on wood, everyone's recovered.
Okay.
And everyone's back to work.
Okay. Do you have any sense, or is there any preliminary evidence on rates of positive tests among homeless shelter residents or clients in New York City?
I don't think I'm not aware of really good data about this in New York City yet, right? Like I know it's been happening at our shelters, right?
Mhm.
There is, so I'll talk about some data that's out there, however. There's this, by now, sort of well-known study done in Boston at this place called the Pine Street Inn. They had a small cluster of people who were positive for COVID, and I'm not exactly sure what possessed them to do this, but they decided to go ahead and test everyone in the shelter. It was like a 96-bed shelter or something like that.
Mm.
And like a significant portion of the people in the shelter turned up positive. I think it was like 40% of the people at the shelter
Wow.
ended up having positive tests. And at the time those tests were taking, none of those people had symptoms. Because
Mm.
anyone who was symptomatic had already been removed from that shelter, right? I think some of those people ended up like went on to have symptoms later, right?
Mm.
But so this is like 3 weeks ago, maybe this study like sort of appeared on the airwaves. And like everyone got really alarmed by that, understandably, right? And that was also around the time it was becoming very clear that there was a significant amount of pre-symptomatic or even asymptomatic transmission, right?
Mm.
And the whole thing had been set up to um, like to put people into isolation beds who were having symptoms, right? So we all started, getting concerned about, yeah, but what about the people who aren't having symptoms, right? Like they're like potentially transmitting virus all over shelter for a couple of days before they get symptoms. So that study really caused the concern, and that really, I mean, the city was already working on these isolation beds just to de-densify the whole system,
Mm.
but that really made people feel more urgent about it.
Okay.
Yeah.
And knowing that there's a lot of different stakeholders that
Mm.
support your system, but for you in terms of the medical care that you provide as part of Janian, what resources additionally do you think, to reduce risk to an absolute minimum, given the structure of how you work for clients and staff, and maybe resources that are difficult to procure right now?
Yeah, I think the as far as like just materials, the challenge has been to get personal protective equipment, PPE. And in the first 3 weeks of this, there wasn't any available, right?
Right.
Like, which I think everyone has some awareness of, like the hospitals like begging for masks and asking people to wear the same surgical mask for days in a row. Like we were doing that ourselves, right? In the last couple of weeks, we've been able to source different pieces of PPE from many different sources, so that's gotten better.
Okay.
And I think the other, big concern is what I just spoke about, is that just places for people to be able to isolate, like really isolate, like
Mm.
you're by yourself, you have your own bathroom that you're not sharing with anyone else.
Mm.
Um, so I'd say those two things have really come along in the last couple of weeks. Like things are really much better.
Okay. Well, any final words on, work in the homeless population, perhaps people in other cities listening to the experience in New York City?
Yeah, I think if my message to other places is get ready, right? Prepare, right? That you know, there was a lesson in Italy, there was a lesson in New York City, right? Like I'm really concerned about different jurisdictions loosening guidance on social distancing and things like that, and having a similar thing happen in your jurisdiction has happened in New York City. It's been awful. It's been awful, right?
Yeah, I agree.
And New York City is a fairly well resourced place, like and has a pretty good public health and homeless services infrastructure that was able to mobilize to like get some of this stuff going, and we're in a pretty good shape right now, and we're going to be getting ready for the fall, right?
Right.
And a lot of places out there don't have the infrastructure New York City has, and they're going to be facing the same thing we did.
Right. So in
So
terms of
yeah,
preparedness then
yeah,
and lessons learned, if
yeah,
knowing it's always 2020 hindsight, but
yeah,
or hindsight is 2020, but if
right.
you look back, aside from having more inventory of PPE,
Hmm.
which we couldn't have anticipated,
Right.
what would you do differently? Or how would you structure what you do differently to prepare?
Yeah. I think, listen, to everybody's credit, like we, like both our agency and the Department of Homeless Services, like really created a new system, right? The isolation facilities are like a parallel shelter system, right? Like,
Yeah,
and right now we're up to 7,000 beds. That's
amazing.
like almost the whole size of a single system right now, right? And our agency like was able to really transform itself into something different in 2 weeks, right? So I
Mm.
guess looking back, so like we did a lot of, I can't think of any particular thing I wish we had done better, right? Um, but I think looking back on it, it would have been nice to have had a pandemic plan in place before the pandemic hit us, right? Like
Right,
I'm not an emergency manager. It's like not in my DNA to plan for a pandemic,
right.
right?
I think most people feel that way, right? If you haven't
Yeah,
lived through one or you're not working in disasters or emergency relief,
right.
it's hard
You
to
know,
know.
I,
Yeah.
yeah, and I'm a psychiatrist on top of that, right? So, I think one of the things that happened in 2 or 3 weeks is that I became an emergency manager, a virologist, and epidemiologist in like 2 weeks. Like
Mm.
that was really challenging, right? And I think,
Yeah.
one of the things that's like was unsettling about it in the early days is that, look, I'm a pretty smart guy, but like I'm on, again, I don't have any specific training in virology or epidemiology, so like I thought I was doing a good job of getting things up and running, but I didn't feel super confident about it just because my training doesn't support that stuff. Like it turns out, like we did a pretty good job.
Hmm.
So,
Well,
yeah, I think
kudos
that's, so
to you.
looking back, I think, could I have prepared better for this like unforeseen crisis, right? I don't know if I could have, but that's what I would tell myself.
Yeah, yeah. No,
Yeah.
but it sounds like you guys have done an amazing job with pivoting in terms of converting to tele with the isolation beds and de-densification. I know you
Mm,
mentioned to me before setting different policies, HR policies and otherwise. So
yes.
sounds like it was a quick transformation. And what
Hmm.
I've seen in talking to different leaders who are managing a workforce or clients is the adaptability and flexibility that's needed and has been so helpful
Yeah.
to manage this. And it requires a lot of inputs and a lot of work and energy, but it sounds like you guys are in a place where it's, contained right now, which is great.
Yeah, it was really impressive to, all these people I've worked with. I've been with the agency for like 18 years now, to watch all these people who I've worked with for, mostly for many years, really being able to be so flexible. Like we all like, we've been around long enough. We all have our set way of just doing things, but we're all able to like get really flexible and like change the way we do things normally when we had to, right? Really impressive. Like I'm really fortunate. I work with a group of people who are really smart, really dedicated, really committed. And
Mhm.
then now I discovered like I'm really flexible too. So it's been great. I just feel fortunate. I don't know. My boss has said to me more than once, right? You want to, as much as possible, trust more the structure of the thing you're in rather than any individual person. Because what if any individual person leaves for whatever reason, right? But I didn't believe him then totally, and I certainly don't believe him now, because what I watched in the last several weeks is that individual people like really stepping up,
Mm.
right, and like going above and beyond their normal way of doing things, their normal responsibilities, and just like filling in the holes wherever they could. And again, it's been really inspiring and impressive.
Yeah, that's incredible. Now,
Yeah.
final question.
Mm.
How do you see, from your vantage point, the mental health needs of your clients changing during this pandemic or post?
Yeah, that's been fascinating. I would have said to you when this all started that people were going to get sicker, right, and be more unstable. And there's been some of that, but it's been actually much more varied than I expected, right? So certainly people who have anxiety problems, especially post-traumatic stress disorder and other post-traumatic kinds of conditions, a lot of that's gotten worse, right?
Mm.
And then other kinds of psychiatric conditions, for some people, their symptoms have been exacerbated, but not everyone. And some people have, not gotten better exactly, but somehow the stress of COVID has like helped them be more organized or helped them be focused on like something that is sort of helping them be more resilient, right?
Mm.
And I've had a lot of my clients, and by the way, I've discovered that you can do pretty good psychiatry over the phone, right? Something I've been resisting for years, right? that people have been really, stepped up and been able to like stay at home really effectively and do other social distancing things effectively, have been able to like, find and use face masks effectively, have been able to like tell me what's going on with them and tell them how they're getting support for themselves, and then asking how I'm doing, right? That's really gratifying. Like people concerned about me, right?
Yeah. How are you doing, Van?
I'm doing good. Like I'm really fortunate. I remind myself it's not hard to do. Like it like every day I'm reminded of how like I can work from home, for example. I have a safe place to be at home, right? My kids are old enough that they can distance learn very effectively without any help from me. In fact, they don't want my help, right?
That makes
I know how fortunate I am. I know a lot of other people, including many of my patients, aren't even close to as fortunate as I am, and like are struggling with all kinds of things, including economically, right?
Yeah.
So I got nothing to complain about. No, I'm really feel pretty good about my situation personally, right? I used to work at Bellevue, so I feel a little guilt not being on the front lines anymore, and I think often about like the awfulness happening at the hospitals. Thankfully, it's getting a little better day by day, but it's been an interesting mix, right? On the one hand, there's like the absolute awfulness happening in the hospitals, and the other hand, like if this is the sacrifice of my generation, it's like hanging out in my apartment for 6 weeks is not too bad, right?
Yeah.
So
yeah,
it's been a weird mix, yeah.
Yeah, and you still can do your job that way, which is really good.
And I can still do my job, and not only that I can pay my rent and feed my family, right? Super important, right? But also that the gratification of my job all the time, which is I'm really like helping people and helping really disenfranchised people who are much less fortunate than I am.
Yeah.
Like that's always been what's gratifying about this. And then in the midst of COVID, like, I mean, of course, you don't know how much COVID you prevented or how many deaths you prevented, but we don't have that many, we have a couple of clusters, but we don't have that many cases in our whole system. And we've had, unfortunately, a few deaths, but not as much as I thought we were going to have. So that's all to say, I think, not only we, the providers and our social service colleagues, but I think our patients have done a really good job of keeping themselves safe.
Yeah.
And that's been super gratifying to see.
Yeah. I think it's wonderful. Well, thank you, Van, so much for joining me and speaking with me about this really important topic, vulnerable populations during COVID-19.
It's been my pleasure. Thanks for having me.
Yes. Now, let's get clinical. So first, quick disclaimer that I used to work as a psychiatrist in residency and after my training at PPOH, which is now known as Janian Medical Care. So for me, I'm highly sensitized to the needs of the homeless population and even more concerned as this pandemic set in. Dr. Van Yu quickly agreed to speak with me on this interview series, and I'm grateful for that, the work that he has dedicated to and his commitment to public psychiatry and public health. What stands out to me from my interview with Dr. Yu are two things. First, an already vulnerable population at risk, given the structure of the way homeless shelters are set up. And second, protections quickly put into place for his workforce and for his clients, the homeless population. On the first, as you can imagine, homeless shelters and safe havens are founded in principles of social connectedness and creating a safe space for those without stable housing. COVID-19 has made these spaces unsafe given the density and close proximity of both clients and staff in an enclosed space. So on the second, how to support the needs of these clients and staff while staying safe has been a key focus for Dr. Yu and his teams. As you heard in Dr. Yu's interview, isolation sites and de-densification were two key areas of focus as the pandemic set in. and for his staff to convert to telemedicine where possible, and procuring enough PPE for healthcare workers to be safe. This was priority. He mentioned that this was not without worry, and it took adaptability and flexibility. And he's seen the strength of his personnel at CUCS to be inspiring and resilient. And now the cases seem to be under control and numbers better than expected, which is a relief to hear. And kudos to Dr. Yu and his teams for their rapid sprint and creating contingency plans in the past 2 months. If you're a stakeholder, as Dr. Yu is and his organization, here is some info from the Centers for Disease Control on working with homeless populations during the COVID-19 pandemic. The CDC recommends connect with key partners to make sure you can all easily communicate with each other while preparing for and responding to cases, including a coalition of local and state health departments, homeless service providers and continuum of care leadership, emergency management, law enforcement, healthcare providers, housing authorities, local government leadership, and other support like outreach, case management, and behavioral health support. The CDC notes that community coalitions can help to identify additional temporary housing and shelter sites, such as overflow sites to accommodate shelter decompression to reduce crowding and higher shelter demands, isolation sites for people who are confirmed to be positive for COVID-19, quarantine sites for people who are waiting to be tested or who know that they were exposed to COVID-19 or who are symptomatic, and protective housing for people who are at highest risk of severe COVID-19. As you've heard, Dr. Yu and his teams have been able to contain COVID-19 among his clients, and our only hope is that the level of preparedness now, which is high, can serve well if another peak emerges in the fall. I'm Dr. Allie Sharma. Thank you for watching Coping with COVID-19.